everyone, I'm Tanya Kuptanani Vatsa. I'm the founder and CEO of Elixir Wellness, and today we're here for episode 6 of Spillingfacts. We're going to talk all about pain relief and recovery with Dr. Kruti Khemani. Dr. Kruti, thank you for being here. I'd love to start by having you tell us about your background and how you got into physiotherapy.
Lovely. It's a pleasure. And, the formal setting is very unusual for us, but we'll try and be good girls. So physio, this is my, technically, if I count from day one of studying it, this is the 24th year.
Wow.
So I was the batch of 2000 and it's a 4.5-year degree. So I finished that and I straight up came back to Bombay from Pune where I studied and got into one of the most esteemed institutions to work in where I learned a lot for over 3 years. And, I've always believed that post-bachelors, you need to work, you need to use that knowledge. And, as a physio, I was always more inclined towards, there's a lot of branches. Okay. So I loved the musculoskeletal and the sports section of physio from the pretty much year 2 of studying. So I got into that kind of work, and thankfully I think my genes play a big role in this. I'm physically strong, which a good physio needs to be. So I think I got into sport. I got into men's football teams very early on, and I thought, great, if I'm doing well, it's time for upgrading that knowledge. So year 3 I decided to do masters, and lucky to get into one of the good universities in Australia, which is University of Sydney. So finished that within a year, and life happened, stuck around in Sydney for almost 12 years before I said time to bring this knowledge back home.
Amazing.
So I think the journey has been very organic, where I've landed up with one of the best mentors I could get, the best bosses, really good workplaces that taught me a lot more than just physio, which was obviously being, a caretaker. I think quality matters, yes, but what also matters is your duty of care. So within healthcare, if that piece is missing, that's the game changer.
Absolutely.
If there's no duty of care, eventually people drop off.
100%.
So, I've been very lucky. Like I said, I learned from the best, I worked with the best, and I'm hoping to now pass it on to the next gen.
Amazing. So tell us about Continuum, how you started, where all you are located, and how you got to the point that you're at.
So like I said, after coming back, which is 2017, we opened doors 2018 Jan.
Okay.
So we're in our 7th year now. And we first started in Santa Cruz, but for whatever reason, lack of business sense is what I would say. We had to shut that because of, money crunch, very specifically. And I said, okay, fine, I still will function. So we moved to a smaller space. By the time that picked up, year 2, COVID hit, which was harsh on all of us within healthcare, but more so us and gyms, because we were very heavily physical contact practitioners. So we didn't have work really pretty much for the first year post-COVID. Again, I think being the Taurian that I am, I wasn't going to give up. So I said, we'll continue. I'm not stopping. And I continued within a very small space in Andheri, which was my mom's.
Okay.
Mom's a pathologist and retired. So that space was lying empty, shut. And we set up shop there with 2 small rooms and continued. And I guess that grew me again as, Continuum got its feedback over there. And then post-COVID 21 is when we opened CAR.
Okay. So
CAR is our main right now. I call it the headquarters. And that's where most of our practitioners and physios that work with us are stationed.
Yes.
Post that 22, we opened Lower Parel, we lasted there for 2 years. And thanks to you opening doors for us, we moved the Lower Parel branch here exactly 2 months now.
Yeah.
So we've been very lucky again. Like I said, it's been very organic. I think I meet the right people at the right time.
Honestly, that's exactly what I feel. I'm like, it just sort of happened that we met in minutes. We hit it off, and Continuum is now at Elixir Wellness in our Pedder Road branch.
Yeah.
And we're so thrilled to have the team. I know that there's so much synergy, not just between our teams, but also between the doctors, between the people, and of course between the clients.
Yeah.
So often I'll see someone in the waiting room and I'm like, I know
them.
this person, and then I'll go out and end up chatting. They're like, oh, Elixir's yours. And I'm like,
That's great.
Yeah, I literally sit here and I know it happens the other way as well.
Super.
So that's been amazing. So Continuum is different from other physio spaces in terms of their philosophy and also the use of machines. I'd love for you to tell us more about why that is and how it came to be.
So, I mean, without sounding like a dictator here, I think 24 years being in this, what I've realized is you can have the best infrastructure, the best machines, the best space for you to provide physiotherapy in, wherever you are in the world, doesn't matter. But what sets you apart is your ability to A, diagnose your patient's condition and issue, B, your ability to plan and customize their treatment for them, and C, to make them less and less dependent on you. And that's a sign of a good therapist, if you ask me. So if I don't want a patient to be dependent on me, why am I putting them on things like machinery or like, equipments where they can't be independently doing what they're meant to do? So for me, it's all about, today I can say very easily, you put me anywhere on this planet, not just, India, but anywhere on this planet. And all I need is hands, my brain, a good heart, and maybe a little bag with some little small bits and bits like creams and gloves and tapes. Yeah. And I'm sorted, and I'll sort you out. So I think a good therapist really needs, firstly, to sharpen their diagnostic and clinical reasoning skills in their first 5 years. Okay. For that, you don't need that big chunky machines. Machines were created for the ease of being able to get people's pain down, okay, so that we could get them better, but also so that they can do our exercises. So physio is really, I would say 60-40, if not 50-50. 60% is active therapy, which is exercises. 40% is passive therapy, which we do to you, or on you. So it's never just passive. But unfortunately, when we started off as physios, it was heavily passive therapy driven. It's gradually changed, and now if you ask me, it's much better. Bombay especially, we're way better. Yeah. We're way ahead of our game in terms of knowing that finally what is it that's going to work is active therapy, which is rehabilitation and exercise programs. The passive side of things can be done through hands, through machines, through, could be needling like acupuncture, massages, whatever it is that you use. But that's just 40% of therapy. And if you stop at that because you feel better, you've only not even done half your work. So we've moved away, like as I mentioned, we don't own machines here at Continuum, not the Pedder Road branch for sure. The HQ branch has a few because we still get a few patients that believe in it. And again, I'm not anti them. Yes, sometimes when the patients don't want to take anti-inflammatories orally, these machines are a good adjunct. But they're not something we rely on at all. Maybe 2 or 3 sessions, just within 15 minutes out of the hour of our sessions is given to those. So yeah, easy. Keeping our expenses low, you see, learning it.
Absolutely.
I know.
So let's start with the basics, the physio assessment. What all do you look at?
So, again, physiotherapy, if you break down that word, it's actually physical therapy. Okay. So what I'm looking to do is physically assess you to see how your entire body is functioning. Okay. So even if you come to me with elbow pain, I'm still going to look at your feet and ankle. You come to me with neck pain, I'm still going to look all the way down to your pelvis, back and ankle and feet. The reason being the body works as one unit. We never just move one part of our body. Yeah. We move the whole body throughout the day. It doesn't matter what task you do. Okay. So each area depends on the other. Each area impacts the other. So we do an assessment called as a 3-dimensional biomechanical assessment. Okay. What involves in that is we're looking at 3 or 4 parameters like your movement patterns, mobility/flexibility, strength and stability. And then obviously looking at your functionality through your history taking and everything. Putting all of this together, we come up with an algorithm, which then spits out to me a very clear picture of your diagnosis. Okay. Now, diagnosis does not have to be a word or a sentence like lumbar radiculopathy or frozen shoulder. A diagnosis can be as simple as you've got an unstable shoulder, or you've got an unstable scapulo-thoracic rhythm, or you've got lumbopelvic instability. And that's more than enough for me to work on not just pain relief, but also prevention of pain. Okay. So from an assessment perspective, we're looking at really assessing you very holistically. Our assessment sometimes lasts up to 45 minutes to an hour. So there are times people block an hour in their first session. I'm like, you know what? sorry I took up the whole hour, but I needed to know this. And we delve a lot more deeper into gut health, mental health, sleep quality, hydration, nutrition, everything. Because you can't separate one from the other. So I love Elixir because we've got it all under one roof.
Yeah, absolutely. And honestly, our consult is, of course, not physical, but it's similar where we're looking at sleep, we're looking at lifestyle, we're looking at medical history, allergies.
Correct.
So our doctors also dive into the whole thing, which is one of the many places I feel our philosophies have been.
And how amazing. We didn't plan this.
No, not at all. So strength and training. I know it's one of the reasons that I come to you personally. Yeah. But a lot of your belief in your philosophy is on getting people ready to work out so that they're injury-free. Correct me if I'm wrong.
Absolutely.
But let's talk more about that.
So like I said, we get you gym ready. What does that mean? Like people say, okay, eye opener, in their 40s, I've not done anything in my life, or I ignored my body for so many years. It's time to start. Before you start, we always say, come in for physio for an assessment. Now, what that assessment tells me is, for example, when you go to the gym, they start off with, say, a lower body day, upper body day, or a push-pull day, or whatever, right? So that involves things like push-ups, squats. Now, push-ups and squats, if you ask me, are like writing an essay, okay? But if your grammar and your ABCDs are messed up, that essay is going to look haywire. That form is going to look terrible. So what we're going to look at is your ABCDs, your grammar, whether you can even write a full sentence. And then we tell you, okay, you're ready for essay writing.
Understood.
So if you're going to go to the gym, but if we find that, listen, your foundations are weak, you will get injured, then it's prevention better than cure. So we give you a pre-gym program to start you off on, get your confidence to that level, and then take you on to say, okay, great, I think you should start with the gym, but let's do a transition slowly. So you continue with physio, start with the gym. We always make sure that whichever trainer you have, we love speaking to them on the phone to say, listen, I think start at this level or start low weights, more reps, whatever it is that we found you like in the first assessment. And that collaborative effort, that teamwork is always better.
Absolutely.
Because then the client or the patient feels a lot more secure, confident, and looked after.
And also the right way to keep them injury-free.
Oh, for sure. I'd rather not, it sounds horrible for business, but that's okay. But I'd rather not see them twice for the same injury. I don't want to see you again, ever.
So I see clients of all ages coming in to Continuum. Tell us what the program looks like for like an athlete versus the elderly.
My background is sports physio, but I have realized one thing. I treat everybody like an athlete. And I'll tell you why. What's the main role of a sports physio? Is to get you back to your sport efficiently, pain-free, and safely. If there is a homemaker coming to me and says, I have not been able to lift that suitcase or lift my child, newborn, since my back pain started. If I treat them like the end goal being that, which is their sport, then the results are going to be equally good. So it doesn't matter if it's somebody who's 25 with an ankle injury wanting to go back to table tennis, or somebody who's 75 who loves traveling but hasn't been able to lift her back. My end goal is very clear what I need to achieve. So I will treat them exactly the same way, where I look at those ABCDs and those sentences and then look at essay writing and see, okay, are they transitioning into that end goal? So the assessment is very similar, barring the capacities which are age specific, of course. The treatment planning we have is based on our grading system we use. And the grading system is very functional. So your grade 0 to 5 is not just for muscles, but it's for function. Right? So we graduate them back to their end goal.
Amazing. So post-surgical care, what is the approach here?
Back in the day when I started, it was very dependent on a very rigid, strict protocol that a surgeon would give you. And fair enough, because we as physios had not developed our knowledge well enough to be able to take that judgment call that at what week post-surgery, what is allowed or what should be done. Even today, I wouldn't say we are the decision makers, but today we are a lot more equipped to discuss with surgeons as two different peers and professionals to say, Doc, you've said week 3 they're allowed to start weight bearing, but we believe they're able to do it
Okay.
Are you okay to assess them and tell us if they're okay with at 2.5 weeks or 2 weeks?
Okay.
So we discuss, it's very open discussions. And unfortunately, I only work now with surgeons that are okay with that discussion, because otherwise it becomes like a direction or a directive given to us, which doesn't feel nice as a professional, because I feel it limits our thinking capacity and our clinical reasoning.
Absolutely.
So it's so much better when there's discussion. It's so much better when I can actually openly talk to a doctor, pick up the phone, they're available, and I know what I'm talking about, and that's the whole team I've encouraged. So I've shared numbers of doctors with the team where I've said, if it's your patient, you better be talking to that doctor post-surgery. So we are always constantly updating these doctors on a weekly basis. Every time we change something, or if we want to add some exercise, I make sure they get clearance from that doctor. So it's either protocol based, but it's again, there is some flexibility to that protocol, thankfully, with nowadays. And post-surgery, of course, if they can't come here, we do provide the home care service as well. But as soon as they're ready to come, we prefer them coming to the centers, because A, the environment and the equipment we have is also more conducive to get those results faster.
Okay.
And B, I'll be very honest, I mean, home care and home visits are luxury in India. So they're obviously going to be priced higher.
Yeah.
So financially, it's any day better to come to centers than somebody coming home, unless you just can't get out of
course,
the house. Then it's a different story. But yeah, that's an option.
Amazing. I actually want to have you tell us the specialties of the team members on your team, because I know when we've discussed, there's such a wide range, and really often I'm like, what is that? So let's pause for a second and get into that.
Yeah, I love that question. So within physio, and even so, maybe not in the first 2 to 3 years of somebody specific PhD in that area. A niche has to be something that you're naturally good at, and you're interested in, and you've then read more about it. So now we've had some sort of segregation within the team where there is somebody who's fabulous with chronic pain cases. Somebody who's had chronic pain and has a lot of psychosomatic issues, and they have to be dealt with very differently. So those kind of cases go to that team member. So we have somebody in-house. Then there is somebody who's really good and interested in working on just TMJ, which is jaw-related pain. And all those cases go to her. Then there's somebody who's fabulous at sports-related exercise prescription and return to sport, so that end phase of rehab. And so all of the cases that initially are with somebody then get transitioned to him. So it's more about utilizing that person's expertise, if that's even the word. I don't think anyone's an expert, but their area of interest and what they're good at, and maximizing on what we can give that client. And it's great to have all of us under one roof.
Absolutely.
Because then we complement each other. So it's an entire collaborative team effort towards that one person. It becomes our project. So each patient becomes a project.
Amazing.
I mean, there are a few other more. There's my batchmate and my colleague, her name's Tanya as well, and she's a pelvic floor therapist. So, I mean, there's very few in Bombay, forget India. So, and she's obviously our age group, a mom of 3, and what better teacher of pelvic floor related issues, and all of our pelvic floor cases get directed to her. So I think, as a workplace, we are very fortunate to have each of these people who are so passionate about each of their areas that they'll do anything to get the results.
Amazing. So Continuum on Instagram does a really fun facts Friday. Tell us a fun fact.
Oh, good Lord. I get teased in how I go to a family gathering and all these younger cousins are like, hi, Didi, fun facts Friday.
So I've actually seen some that I've resonated with and shared them on the Elixir page myself.
But I can't help it now. It comes so naturally. I'm not stopping it. They can have fun.
Please don't.
Oh, you want to know a fun fact? I mean, I say this in my consults to people as well, but I think what we've forgotten is we were 4-legged animals, and from 4 we became 2-legged, and we undermine the power of those buttock muscles. So what's keeping us upright is our backsides. So get those backsides strong is what I would give you. Well, before sport, there's a lot more. But yes, so that's something I'd like to share.
I Actually, I've discussed this with you in the past, so I know the answer. But for everyone else listening, do you get a lot of injuries from the gym? And how do we prevent this?
As in myself. But what's good to know is that there is available help within gyms now, but a lot of gyms have got physios in-house or collaborated. So like we've collaborated with a few, and the collaboration is not really on paper also, it's just organic, because some of the trainers come to us and they feel, oh great, I think I want to send a lot of my clientele to you because I'd rather not see them injured, and they've got the ulterior motive of keeping them in the gym, so they don't stop saying, oh my shoulder's bad, I'm not coming. So again, gym injuries, very common, nothing to be scared of. We'll get you back to that gym, don't you worry, but we'll let you know what you need to do in the interim. So yeah, the gym is your best friend. Everybody should have a friend who owns a gym. Or you make your own.
Yes. So my last question actually today to end this really interesting session is about our philosophies, which Elixir and Continuum have been really well aligned since day one. And one of the things I know both companies focus on is sports recovery.
Right.
So let's briefly talk about the importance of that in today's day and age.
I think as a culture, we were not taught self-care. I've realized that. So recovery is something that people think it's a luxury. It's only for the elite. No, everybody needs recovery. Of course, you have a budget, you stick to that budget. But recovery is so important because it's for the longevity of your sporting career, if that's your career, or it's for the longevity of you wanting to continue a particular type of sport or exercise through life, because that's your happy place. So if you're going 5 days a week or 6 days a week, absolutely the 7th day should be recovery day. And now there are so many options for recovery.
Absolutely.
Thanks to Elixir. So that recovery absolutely is something that we guide them as well as physios, but even coaches, trainers, everybody should know. So it's something that I guess that's another collaborative point for us as well. But it's amazing that we believe in giving that option to people, but also assessing what will work for them. Because not everybody's cut out for a deep tissue massage. Not everybody's cut out for cryo. Not everybody's cut out for some sort of a ice bath. So whatever works for you. Of course, trialing, erroring will happen.
Absolutely.
But whatever works for you in feeling much better after that 24-hour recovery, and so you're ready and raring to go on that Monday, is what you stick to.
Makes sense.
But of course, trialing everything is the first thing, and keeping in mind the medical conditions they have, of course.
Sounds great. Thank you so much, Dr. Kruti, for being here today. Thank you all for listening. Don't forget to subscribe to Spilling Facts at the Elixir Wellness page on YouTube, and we'll see you back soon for another session.